those twisted rope-like veins pushing up through the skin on your legs. Most people think they're just a cosmetic issue, something to cover up, something to be embarrassed about at the beach. That assumption is costing people their legs, and in some cases, their lives. I want to be very clear with you before we go any further. What I'm about to share with you is not about vanity. It never was. My name is Dr. Shigeaki Hinohara. I'm a vascular surgeon with 22 years of clinical practice. I've performed thousands of procedures on legs that looked, from the outside, completely manageable. And I've sat across from patients who told me they waited 2 years, 5 years, a decade, because no one ever told them what those veins actually meant. There's a patient I think about often, a 54-year-old high school teacher named Martin.
He came into my office on a Tuesday afternoon, rolling up his trouser leg almost apologetically, like he was wasting my time. His wife had finally pushed him to come. He had these prominent bulging veins running up the inside of both calves, and he'd had them for about 6 years. He said, and I remember this exactly, I figured it was just one of those things. What Martin didn't know, what nobody had ever told him, is that those veins were a signal. His venous system, the network of vessels responsible for returning blood from his legs back to his heart, was under serious strain. And it had been, quietly, for years. By the time he sat in my chair, the damage to the deeper valves in his leg was already significant. We caught it. We treated it. But Martin told me afterward that he wished someone had just explained what was actually happening inside his body. That's why I'm here. Let's start with what's actually going on, because most people have no idea. Your veins are not passive tubes. They contain tiny one-way valves. Imagine a series of trapdoors spaced along the inside of a pipe. And these valves open to let blood move upward toward the heart, then snap shut to stop it from falling back down. It's a system that works against gravity every single day of your life. When those valves weaken or fail, blood begins to pool. It collects in the lower sections of the vein, the walls stretch under the pressure, and the vein begins to twist and bulge outward. What you see on the surface, that raised bluish-purple cord under the skin, is the visible result of a valve problem that started deep inside. I always explain it to patients this way. Imagine a garden hose with a kink in it. The pressure builds behind the kink, the hose swells, and eventually the walls start to give. Except in your leg, that kink is a failing valve, and the hose has been under pressure for years. According to data from the American Venous Forum, chronic venous insufficiency, which is the clinical term for what's happening when those valves fail, affects approximately 40% of adults in the United States, 40%. And a significant portion of those people don't know they have it because they've been told, or they've assumed, that visible veins are simply cosmetic. Here is the first thing I want you to understand, and pay attention here because this is where most people go wrong. The veins you can see are not always the veins causing the most damage. Varicose veins, the large, raised, twisted ones, get all the attention. But the real problem frequently lives in the deeper venous system, where you can't see anything at all. Those surface veins are often a downstream effect of valve failure happening in vessels buried deep within the muscle, which means someone can look at their leg, see just a few spider veins, dismiss it entirely, and be walking around with significant venous insufficiency they have no awareness of. This connects directly to what I want to show you next. The heaviness you feel in your legs at the end of the day, that leaden, dragging exhaustion in your calves and thighs, is not just tiredness. Most people chalk it up to being on their feet, to getting older, to needing better shoes. And that explanation is comfortable because it requires nothing. No appointment, no conversation, no change. But that heaviness is pooled blood. It is venous pressure building in the lower leg as the day goes on, and gravity does its relentless work. And it doesn't just feel uncomfortable. Over time, that sustained pressure begins to damage the surrounding tissue in ways that are very difficult to reverse. A 2019 study published in the Journal of Vascular Surgery tracked patients with symptomatic venous insufficiency and found that those who delayed treatment by more than 3 years showed measurably greater tissue damage and a significantly higher rate of skin complications than those who were treated early. The window matters. The clock is running. Now, does any of this sound familiar so far? I'm asking genuinely. If you're watching this and nodding, if you've been dismissing leg heaviness for years, or if someone you love has been living with this, I want you to type yes in the comments. Because the number of people sitting with this silently is far larger than most people realize, and I want to know who's actually here. Let me tell you about something that doesn't get nearly enough attention in patient education, and I have never seen it adequately explained in a standard health brochure: nighttime restlessness in the legs. Not restless leg syndrome, which is a neurological condition. I'm talking about a specific sensation, a deep aching, sometimes a low-grade burning, sometimes an almost electric restlessness that settles into the legs after you lie down. It often starts an hour or two after you go to bed. The house is quiet, you're tired, and then it starts. It doesn't hit you during the day when you're busy and moving. It waits until you're lying in the dark, legs elevated slightly by the mattress, and your nervous system finally has nothing left to distract it from the pressure that's been building all day. Some people describe it as feeling like the legs need to move. Some describe it as a warmth that won't resolve. Some just know they cannot get comfortable, and they don't know why. This is venous pressure expressing itself at rest. When you stand or walk, the calf muscle pumps blood upward. It's called the calf muscle pump, and it's actually a critical component of your venous return system. When you lie down, that pump stops. And in legs with compromised valves, the pooled blood redistributes, the pressure shifts, and the nerves in the lower leg begin registering the sustained distension of the vessel walls. Think of it like a water balloon that's been slightly overfilled. During the day, you're holding it, squeezing it, moving it around. At night, you set it down, and you start to feel how heavy it actually is. If this is waking you up at night, or keeping you from falling asleep, that is not something to manage with a pillow under your legs and a hope that it improves. That is a signal worth investigating. Here's where I need to slow down, because what comes next is the part of this conversation I consider the most important. The skin changes. Most people, when they think about varicose veins, think about the veins themselves. They don't think about the skin. But the skin around the lower leg and ankle is one of the earliest places the body shows you that the venous system is failing in a way that has gone beyond cosmetic. Look at the skin around your inner ankle. Look at the lower calf. Are there areas that appear brownish or reddish? A discoloration that doesn't tan, doesn't fade, that has gradually darkened over months or years? That pigmentation is called hemosiderin staining, and it happens when red blood cells, under prolonged venous pressure, begin leaking out of the vessel walls and into the surrounding tissue. The iron from those cells deposits in the skin, and it stays. I always describe it to patients like rust forming on a pipe that's been under too much pressure for too long. The pipe is leaking at the seams. The rust tells you how long it's been happening. This is where it gets serious. And I want you to stay with me here. When venous pressure remains elevated long enough, when those blood cells continue leaking into the tissue, the skin itself begins to change in texture and composition. It becomes thickened, hardened, and fragile simultaneously, a condition called lipodermatosclerosis. The skin can appear shiny, tight, sometimes almost wooden to the touch around the ankle. And skin in this state is extraordinarily vulnerable. A small cut, a minor scrape, an insect bite. In healthy skin, these heal in days. In skin that has been compromised by years of venous insufficiency, a wound like this can become a venous leg ulcer, an open wound that the body struggles to heal because the very circulation system needed to deliver healing resources to the tissue is the one that's failing. The American Wound Care Association estimates that venous leg ulcers affect roughly 1% of the adult population. That translates to over 2.5 million people in the United States alone, and that these wounds account for the majority of all chronic leg wounds seen in wound care clinics. The average healing time for a venous leg ulcer with proper treatment is months. Some never fully close. Let that sit for a moment. This is what an "it's just cosmetic" assumption can become when it's left untreated long enough. Not because it was inevitable, but because nobody explained what the progression actually looked like. Martin, the teacher I mentioned at the start, when he came back for his 6-week follow-up after his procedure, he told me that the night before his appointment, he'd done something he hadn't done in 3 years. He'd slept through the night. He said it so quietly, almost like he didn't want to make too much of it, like he'd forgotten that sleeping through the night was something people were supposed to be able to do. That's what this costs people. Not just health, ordinary life, sleep, comfort. The small, unremarkable things that are only remarkable when they're gone. Now, here is what I want you to do, not eventually. Now, start with compression. If you are not already wearing graduated compression stockings, not the generic pharmacy socks, but properly fitted medical-grade compression, 20 to 30 milliliter mixing, start there. The evidence behind compression therapy for venous insufficiency is some of the strongest in vascular medicine. A 2021 Cochrane review confirmed that consistent compression therapy reduces venous pressure, relieves symptoms, and significantly slows the progression of skin changes in patients with chronic venous disease. It is the single most accessible, evidence-supported first step you can take. Second, elevation. When you rest, elevate your legs above the level of your heart. Not just on a footstool, fully horizontal, legs raised on pillows, for at least 30 minutes, twice a day. This is not complicated. It works by using gravity in your favor for once. Third, move. The calf muscle pump I described earlier, that's your ally. Walking is one of the most effective interventions for venous insufficiency. Not running, not high-impact exercise. Walking, 30 minutes most days. The muscle contraction actively assists venous return and reduces the pooling that drives every symptom on this list. And fourth, and this is the one I need you to take seriously, see a vascular specialist if you have visible varicose veins along with any of the following: skin discoloration around the ankle, leg ulcers that are slow to heal, nighttime symptoms that are affecting your sleep, or a sense of heaviness or swelling that hasn't improved on its own. A duplex ultrasound, a non-invasive, painless imaging study, can map the venous system in your legs and tell you exactly which valves are failing and how significant the damage is. Modern treatment options are minimally invasive. Most are done in an outpatient setting. Recovery is measured in days, not weeks. The point is not to scare you. The point is the opposite of that. The point is that this is manageable. That the window, the period where intervention is straightforward and outcomes are excellent, is wide open for most people watching this. But that window does not stay open forever, and the quiet progression from visible veins to skin changes to wounds, to something much harder to treat, does not announce itself loudly. It moves slowly, politely, almost invisibly, until one day it doesn't. If you're still watching, share this. Not for the channel, for someone. You know someone who's been waving this off, who's been wearing long pants in summer, who's been lying awake at night with their legs aching and telling themselves it's fine. Tag them. Send this to them. You might be handing them something they needed before they knew they needed it. One last thing. If you take nothing else from everything I've just told you, take this. Your body has been trying to tell you something. Those veins are not a cosmetic complaint. They are a conversation your circulatory system is trying to have with you. The question is whether you're willing to listen. Tonight, before you go to bed, look at your legs. Really look. And if something doesn't seem right, if it hasn't seemed right for a while, let that be enough reason to make the call. You deserve to sleep through the night.